going to talk about 3 different types of heart conditions. The first being angina, where the blood supply to the heart has been restricted. Now, most of the time someone would have been diagnosed with this, so they may have some medication that they can take. And quite a lot of the time it's brought on by physical activity. So usually once they've rested, you'll see quite a fast improvement, or once they've taken the medication, you should see them improve quite quickly. If you're in doubt and the medication isn't working, then just call 999. The second heart condition is a heart attack. So this is when the artery is completely blocked. So there is an area of the muscle of the heart is completely restricted from blood flow. So this can be life-threatening, and it's critical that we deal with that as quickly as possible. Some of the signs and symptoms that you might see for that is someone complaining of chest pain or tightness around the chest. They may say that their arm hurts, usually the left one first, but it could also be the right arm. They may also experience pain in the abdomen, the back and the jaw. They also may be experiencing nausea, or actually being sick, feeling dizzy. They may be quite clammy and starting to look quite grey in colour. No 2 heart attacks are the same, and they can look quite different for each individual, and they may not experience all of those. So just be aware of all the different types of signs and symptoms, and if in doubt, just call an ambulance as quickly as possible. Okay, so we suspect that this gentleman is having a heart attack, so I need to ask for somebody to call an ambulance as quickly as possible and discreetly ask them to get an AED, so we have one close by just in case this person stops breathing. So ambulance on its way. I'm going to try and keep them as calm as possible, and I'm going to see if they have any chewable aspirin, so 150 to 300 milligrams of chewable aspirin, and that can help thin the blood and slow the process down. I'm going to place them in what we call the W position. So if you can just raise your knees, put them together, that's it, and I will just support you from the back. You can lean back a little bit. Okay, is that comfortable? Yeah? So I'm just going to keep him nice and calm. If he has any tight clothing on around the neck or chest, I'm going to loosen that off, keep him warm, and just support him until the ambulance arrives. The third is a cardiac arrest. So this is different to a heart attack, and basically a cardiac arrest is when the heart stops working. So there is no blood flow around the body. So if that happens, you'll see them collapse to the floor, maybe going quite grey to start with before collapsing, and they will stop breathing. So then of course we need to call an ambulance, get an AED and start CPR as quickly as possible.